We go to do a special thing. You know, it's very interesting. We go to show you 10 minutes how the people are working on these new procedures. Konstantin Stan, who was assisting last year in the course, and Dr. Raul Chioibas from Romania, as today, combination sutures 8 months or 7-8 months, Raul.
Yeah.
But with fantastic results. And I think this is very good because maybe next course, if they have experience and have results, can show us and can really add the knowledge, because we are learning everybody from everybody. That means we go to show and then we have the discussion. Okay?
Okay, Dr. De Benito, thank you very much for this opportunity. My name is Raul Chioibas. So I will be very short because the time is already late, and I will get directly to the point of our technique of marking the patient before going to the surgery. First of all, the silhouette sutures are addressing these regions of the face, and first of all, the nasolabial fold that we will lift by using the silhouette sutures, the marionette lines that will be improved after this type of surgery, and of course the jawline. And in some cases where we need also a lower blepharoplasty, we can also improve the tear trough area. Important landmarks that we usually mark on the patient before surgery are the temporal crest, the zygomatic arch, and the area of passage of the frontal branch of the facial nerve, and of course the sentinel vein. These two things are very important to talk about from my point of view, because in this area, as everybody knows and as everybody saw in the previous lectures, in this area, we actually have to be with the suture when passing the intraductor very superficial in order not to damage any of these, either the nerve or the sentinel vein. And of course, we usually mark also the area where the parotid gland is in order to have in the end the last two exit points of the sutures that we're placing in the area in front of this marking landmark. And then, of course, the incision in the temporal area that we are marking from the lateral canthus of the eye, 7 centimeters the medial landmark, and 8 centimeters the lateral landmark. I was talking with our colleagues previously, and one of our colleagues said that 2.5 centimeters is a pretty large incision considering the silhouette lift. Yes, I agree on that. But we are usually making this larger incision because usually we combine with the silhouette lift also a broader dissection of the temporal area, because we think we can by this elevate a little bit of the corner of the eyebrow as well. So this is the dissection area, and sometimes, if necessary, we go until the lateral border of the eyebrow in order to get this bit of elevation. And then the marks, the exit points, a small difference that we usually make compared to the other types of marking that we've seen yesterday and today, is that we go with the 3 and 4 exit points a little bit higher than those described earlier. And usually in this image, it's not exactly what I'm talking about now, but I will explain you. Usually we go on the landmark from the corner of the mouth to the insertion of the earlobe. And this is why we will get these inferior points a little bit higher. We think that we will get a better imbrication because of that, and in the end, a better fullness of the malar area. And of course, the suspension points, that the first 2 points will have an oblique vector, and this is why we will suture them at the lateral end of the incision, and the third and fourth threads that are sutured in a vertical fashion at the medial part of the incision. Okay, this is a short movie about how we combine together with the silhouette lift the hyaluronic acid injection in order to enhance the volume in the malar area. I'm not going to stay on this very long. And this is a temporal dissection. You see the longer incision that we're making around 2.5 centimeters. And as a tip for the dissection, we first go with a mosquito and then with a forceps, with a Hellman radiosurgical forceps, in order to prevent the bleeding. So it's a prospective hemostasis that we're doing. And then we go down to the temporal fascia, and from this point we can dissect the whole area, the whole temporal area, also not needing an endoscope, because if you use a frontal lamp, you can see very clearly all this area, and you can dissect it by scissors and by dissectors. Okay? And this would be the suture insertion that I'm not going to explain, because these are some cases that we have. We don't have a very broad experience. It's only a few months, between 5 and 7 months. But some cases and some results after this time that we have. So this is a case where we've done only a silhouette lift without any adjunctive technique. Only that we've put some hyaluronic acid in the tear trough in this area, and this is the result after 7 days. This is the patient that we were showing also the markings on. It's a patient where we've done, beside the silhouette lift, also the lower lid and the upper lid. And this is the result after 9 days. You see here as a little comment that we had by looking at the pictures after the operation. After 1 month, the result can be pleasing also from my point of view, from our point of view, also in the area of the eye. But after 4 months, for example, we've noticed, and you can notice as well, the hollowness of the upper eyelid. This is because we actually resected a little bit of fat in this area, and the whole conference was about being very conservative. And this is a very good case to see that this fat shouldn't be removed. You see, again, after one month, because of the edema, everything is nice. But after 4 months, the edema is gone, and we have this hollowness of the upper eyelid.
You didn't hear my talk. You didn't hear my talk when I said I've done the wrong operation 3,000 times.
Yes. This is why it's nice for us young surgeons to meet surgeons with experience like you, and to really do and to hear what you say.
Not all subjects.
Yeah.
Wrong operation 3,000 times.
Okay, so again, in this area, you see this is another patient that we've done with silhouette, suture, lift, upper and lower eyelid, and hyaluronic acid. And this is the result after 1 month. You see the nice improvement of the cheek area, of the malar area, and I don't have the
Where
the
did you
pictures.
put the hyaluronic acid in that case? Where?
In the malar area, and I don't have the picture here, but the lower lid was done as Dr. Bates said in a conservative fashion. You see before operation, before the operation, you see this herniated fat here. This was not excised. This was just repositioned in 3 points with little bourdonnais. So we went with a nylon suture and repositioned it in the area where we needed to make the fill, and tied the suture on a little bourdonnet, three pieces on each side. And this is the result after 1 month. And hyaluronic acid again, just in the malar area.
How much?
Well, to be honest, I couldn't tell you exactly, but around 1 mil. We usually don't go more than 1 milliliter. This is another case where we did. You see, this is what I was discussing with the colleagues today. We usually combine. Silhouette lift is a tremendously good technique, but we feel that if you combine it with adjunctive techniques, like lower lid, like a little bit of volume enhancement, it could be a magnificent result. And this is what we feel that we can get, at least when the patient is coming in, she's smiling. And this is already something that gives you the thing that you need to go for. And this is another interesting case that was in our clinic 7 years ago. This is the picture 7 years ago, yes? And this is 3 months after the first subperiosteal Ramirez Techniques facelift. This is how she looked 6 years and 7 months ago. So 7 years, 6 years, and 7 months. Only after the 3D mid facelift. And then after 4 years, this was her aspect. Coming again in the clinic and asking for some improvement of the previous surgery and of her face. Then there has been done microlipostructure, so filling with autologous fat. And this was the picture taken 10 days after this procedure. And then 2 years after that, the face was looking like this. These 2 years means 6.5 years from the previous picture that you've seen. So from the beginning, from the moment, from the zero moment. And then we had done a silhouette lift. And this is how she looks. And now a comparison. This is 7 years ago, almost 6.5 years ago, and this is now.
Did she have a rhinoplasty?
Not with us. And the thing I was talking with Franco and our colleagues, we thought when we made that presentation to put something on the lips, because this is something that is highlighting in the picture, and we wouldn't want the audience to look at that. So we're not very pleased with the aspect of the lips, but please do not look in that area. We're talking about the mid-face now, about the silhouette lift that lifts the mid-face, yes? So this is the result that we get after 7 years. And of course this picture only to show you the lips when she was 31 years old. So
A little Botox. Lateral, right?
yeah, she has a lot of Botox. Yes.
She needs a little Botox.
This is a patient that demonstrates the fact that silhouette lift can be a very good adjunctive. Also, not only a primary technique, but also a very good adjunctive technique to enhance and to keep the results that the patients are expecting. After years, this is the gravitation and the skin laxity and all the factors are being seen on the face, and we cannot do anything against it. But we can do the silhouette lift to give the aspect that the patient wants. Okay, this would be it. Thank you.
Thank you very much. That ends our formal presentations, but we're going to have discussion time now. And I want to start it by saying that was a beautiful presentation, and I'm extremely happy that you came forward.
A dense breast, a younger breast of 19 years old. You can't feel it. You can't feel it, yes.
All right. Now you say you had one